Afternoon, everyone. With me, Catherine Morgan-Wicks, State Health Commander, and obviously Dr. Mark Veach, Director of Public Health. As we're all aware, COVID-19 continues to evolve rapidly on the mainland, and our priority here continues to be on protecting the health and safety of Tasmanians. I know that I speak on behalf of all Tasmanians in saying that our thoughts are with those in New South Wales, Victoria and now South Australia, and in pockets around the country as well in Queensland in terms of hotspots. Tasmania currently has strong border restrictions in place with the entirety of Victoria, and New South Wales declared as high risk in both areas. We also have restrictions in place for a number of high-risk premises and exposure sites throughout Queensland. And those people that might be either travelling to Queensland or coming home from Queensland, please continue to monitor these sites. If you've travelled to Queensland or if you've recently returned, an update will be provided this afternoon in terms of the exposure sites in relation to Queensland, but we will continue to manage those on a hotspot basis as it stands at the moment. Both Victoria and New South Wales have today seen an encouraging downward trend in the number of cases confirmed, but have considerable work to do before their lockdowns can begin to be eased. Now, Victoria have extended their lockdown by another 7 days until Tuesday the 27th of July, and our restrictions will remain in place for this period at a minimum as well. Overnight and this morning, South Australia has also reported 5 locally acquired cases and has today announced a statewide lockdown from 6 p.m. tonight for 7 days. In response, from 4 p.m. this afternoon, all of South Australia will be declared high risk level 2 by Tasmania's Director of Public Health. This means anyone wanting to travel to Tasmania from South Australia will not be permitted to enter from 4 p.m. today unless approved as an essential traveller, including returning Tasmanians. For people in Tasmania who were in South Australia on or after the 8th of July, they are advised to immediately check the currently designated high-risk premises in South Australia. Anyone who has been at one of those premises at the dates and times specified should immediately self-isolate and contact the Public Health Hotline on 1800 671 738 for further advice. I just want to touch on Victoria briefly. With the lockdown continuing for a further 7 days, the restrictions we currently have in place will continue until at least the same period that their lockdown's in place for. Now, in terms of the exposure sites, and for those people that are currently in Tasmania, almost 300 high-risk premises are now identified in Victoria, and if you've been at any of those premises at the dates and times identified, you'll not be able to enter, as we've previously discussed, but importantly, contact Public Health and the Public Health Hotline. Now, in terms of masks, and I just want to deal with Victoria and South Australia. In terms of Victoria, if you've returned to Tasmania, you must continue to wear a mask until Friday at 11:59 p.m. at this stage, noting that this may be extended and that there will be an update that will be issued on Friday in terms of mask wearing if you are in the state from Victoria. In terms of South Australians, if you've returned to Tasmania since the 8th of July and are here in the state currently, you must wear a mask until 14 days has passed since you left South Australia, as long as you have no symptoms, and if you have symptoms, obviously contact Public Health and speak to them and arrange a test. Now, in terms of attendance at schools, given the extension in the mask wearing requirement for those people who have arrived from Victoria, and with now South Australia being included as well, we now require this group of students and staff to remain away from school for the remainder of this week, with an update to be provided on Friday, noting that the Victorian mask situation has been extended until 11:59 on Friday night. But in terms of South Australia, we'll provide an update then as well, but at this stage it's for 14 days since you were last in South Australia. Now, importantly for students, there are learning at home resources available for impacted students to support them to engage in their education through this period. When not at school, it's important that those Tasmanians, noting that this requirement for students not to attend school is for all students, but the mask wearing protocol that we have is for children under the age of 12. It's important that those Tasmanians 12 years and older who've been in South Australia or Victoria must wear a mask when in public, limit their movements in the community and follow the public health advice. I want to thank our students and their families and our DOE staff for the work that they've done to ensure that this challenging and unusual set of circumstances can be managed. Now, we estimate that the requirements will only affect a small percentage of our student population. I understand there's a little over 3,000 people in the state, Mark, I think that's right, that have returned from South Australia in that period, but obviously a larger cohort in terms of Victoria. Now, in terms of travel, can I just remind all of those people that have recently travelled to please be vigilant. New high-risk premises are being identified on a regular basis. Please monitor the coronavirus website, review the high-risk premises regularly, and importantly, if you've been at any of those identified premises at the dates and times identified, self-isolate immediately and call the public health hotline. If you have any symptoms, even mild, please get tested. Now, I want to touch briefly on vaccination, and Catherine Morgan-Wicks will cover this off in a little more detail. Well, but we're almost at the end of week 22 of the vaccination program. Almost 44% of Tasmanians have now received one dose, and almost 19.5%, so getting very close to 20%, are fully vaccinated with 2 doses. In terms of those Tasmanians that have had 2 doses, that's more than 85,000, nearly 86,000 Tasmanians have received a second dose. The message I want to convey today is that if you work in the aged care and disability sector and you've not had your first dose, please make a booking today. There are appointments available right now around the state. Now, we continue to work with the Australian Government to speed up the rollout in disability care settings. The Australian Government is increasing the number of providers offering in-reach vaccination services from the beginning of August to include 3 providers, speeding up the process. We also have specialist clinics operating both in Hobart and Launceston at the moment, which include quiet days with appointments available this week. You can also book into a community clinic, and 26 GPs are also offering the Pfizer vaccine. Importantly, if you are a carer and concerned that your family member or person you care for may miss out on getting vaccinated, please make contact with us and we will work with you to schedule a vaccination. Tonight you'll see the first of a series of ads encouraging Tasmanians to get vaccinated and importantly turn up for their appointment for the second dose. Given that the second dose is vital, we would encourage all of those that are due a second dose to ensure that you get it, to ensure that you have the greatest protection. So just to recap, so South Australia, we will close our border and designate them a high-risk area from 4 p.m. this afternoon. And in terms of mask wearing, the requirement for those who have returned from Victoria is being rolled over and extended into 11:59 p.m. on Friday night, but there will be a further update on Friday. And in terms of those that have returned from South Australia and are in the state, we'd like you to wear a mask. It will be a requirement. And importantly, that mask needs to be worn for 14 days from the period from which you were last in South Australia. I'll now hand over to Dr. Beach.
Thank you, Premier. I might provide a quick run through of some of the rationales for these decisions and an overview of the national situation, which is quite complex and changing, and I can understand that people might find it even confusing at times. I think the really important thing is that people who have been in one or another of the mainland states pay careful attention to the information on our website and any messages you receive, and follow that advice, please. And most people, they'll really only have to have their head around 1 or at most 2 states. So the situation today in New South Wales, while still of concern, was similar to as it had been in the last few days, with around 80 cases reported up until 8 o'clock last night. Most of those cases in southwestern Sydney, and a large proportion of them with links to previously known cases. But still, a number of cases in New South Wales diagnosed amongst people who had moved in the community for some or all of the time when they're infectious. Because of that, we really have to expect, unfortunately, that there's going to be cases in the community and linked to households and close contacts of New South Wales cases for a couple of weeks at least. So unfortunately, New South Wales is clearly in for the long haul in terms of controlling that outbreak. There have been no cases in regional New South Wales, but a couple of exposure sites from people who had moved in regional New South Wales while infectious. So the approach that we've taken to New South Wales will remain the same. People who from greater New South Wales, from all of New South Wales, are unable to enter Tasmania unless they have permission from the Deputy State Controller, and people who have been at any one of the many hundreds of exposure sites in New South Wales can't enter. Victoria has a much smaller outbreak than New South Wales, and they had, I think, 13 cases today, which is the same number as yesterday. Small number, most of those cases linked to known cases, so it reflects a pretty good containment of the Victorian outbreak, a good understanding of where cases have been and posed risk, and good tracing back to identify the source of each of those cases. I think there was only one case that was still under investigation in Victoria to try and find the link. However, because of the very high-risk exposure sites in Victoria and the movement of some cases in regional Victoria, Victoria has taken the very reasonable step of continuing their lockdown for another 7 days. The main measures that we've had in place for Victoria are firstly the prohibition of the entry of people from Victoria to Tasmania without an exemption from the Deputy State Controller, and that's been in effect since Thursday night, in addition to the various hotspots that we continue to list. As the Premier stated, we required people who have been in Victoria since the 8th of this month to wear a mask when they're in public, and that requirement came into effect midnight last Friday. And the reason for that is because we have a large number of people in Tasmania from Victoria. Even though each individual probably poses a very low risk of coronavirus infection, there are, as you know, over 10,000 people who are here who have been in Victoria over that time frame. And by asking those people to wear masks, it reduces the risk of them spreading infection if they have been unknowingly infected at one of the Victorian exposure sites. We will be keen to remove that requirement from people as soon as it's safe to do so. And the main thing that we look at when we determine whether it's safe to remove that mask wearing requirement is whether places that these people, whether there's a reduction in the new exposure sites announced from day to day in Victoria. Because every day we reach out to people in who have been in Victoria who are currently here with an SMS and say, check the exposure sites. And each day there are new exposure sites added in Victoria. I think there are about 40 added today. And over the last couple of days, we've always picked up some people who've been to one or another of those exposure sites. There were 16 people picked up a couple of days ago, 6 yesterday. So when we get to the point that we're not picking up people in Tasmania who've been to exposure sites in Victoria, that's the point at which we'll be more comfortable about removing the mask requirement. At the moment, we're extending that mask requirement until Friday midnight, but if people have passed 14 days since they left Victoria, which for some people will be Thursday or Friday, they're no longer required to wear masks. South Australia was the latest state to have some troubling cases, and they reported today 4 cases transmitted amongst one family and an additional case acquired in an exposure site in the city of Adelaide, where it was known that one of those other cases was when they're infectious. And South Australia has gone into a lockdown from I think later this afternoon. There are a couple of unknowns about the South Australian situation, which is obviously one of the factors that is causing South Australia to go into lockdown. If they're not completely sure that they've got all the potential chains of transmission identified and locked up, they don't want the possibility of spread through a freely mixing community, which is what South Australia is like. If we look at the data on how freely people are mixing and moving in their communities, The three states that are mixing and moving most frequently are South Australia, the Northern Territory and Tasmania. And we know that fortunately the Northern Territory and Tasmania doesn't have community cases, but South Australia does, and that's why they're applying their statewide lockdown. With that in mind, we're doing what we're usually doing, which is to echo the approach that South Australia is taking, and we're, as the Premier said, from 4 o'clock today, I'm declaring all of South Australia as a high-risk level 2 area, and that will mean that people won't be able to enter Tasmania from South Australia unless they have the permission of the Deputy State Controller. And if they do, they'll be required to go into quarantine either at home or a suitable place, or if they don't have such a place, into hotel quarantine. And people who have been to any of the high-risk sites in South Australia, the high-risk premises, won't be enabled to enter Tasmania for the time being. We're going to take a similar approach to people who are currently in Australia from in Tasmania from South Australia, as we are for Victoria, and to require, by direction, people who are in South Australia who have been there, people who are in Tasmania who've been in South Australia since the 8th of this month, to wear a mask. At the moment, it's for 14 days after they've left South Australia, but if we're able to end that requirement sooner, based on reduction of risk in South Australia, then we'll do so. And Queensland's the last of the states that came onto the radar today. They have announced today a case who was infected at a known exposure site in Victoria, travelled home to Queensland, had an initial negative test but subsequently became positive. And they had moved through a couple of locations, a shopping centre I think, and a restaurant in the Sunshine Coast, and also took a range of mechanisms of travel to get home in North Queensland. And we'll be listing those transport routes and the exposure sites in the Sunshine Coast as high-risk premises, and we'll be putting messages out to people who've been in Queensland recently to make sure that they check that they haven't been at these sites, and if so, to contact our public health hotline. I think it's fairly unlikely that we're going to have any people in Tasmania caught up in that, and so for the time being it's just a single case there. So I might just leave it there if people have any questions.
I saw a Facebook post today about someone who's having some complications with the community clinic booking system and the app to get their vaccination. Is that question best for you or for Ms. Witt?
I might pass it on to the Department Secretary.
Do you think some of the mask wearing rules could be getting a little bit confusing, being different, slightly different for every jurisdiction at the moment?
The only one that I think matters is the mask wearing rule for Tasmania. What that mask wearing rule is applying to is people who've come out of a place where there's evidence of coronavirus in the community to greater or lesser extent. It's more of a problem perhaps in Victoria than it is in South Australia at the moment, but we're simply asking people, if you've been in that site, in one of those locations, and you've come usually home to Tasmania, wear a mask when you're in public for 14 days. I think that's pretty straightforward.
Thank you, Mark. And I'll just provide a short update on vaccination. As the Premier has said, Tasmanians are responding very positively to the vaccination program, and our forward clinic bookings are very strong. The vaccination program is finishing week 22 very strongly. As at 19 July, we have delivered 279,437 doses across Tasmania, which is made up of 143,565 doses in state government clinics, 15,040 by the Australian government provider in aged and disability care, and 120,832 doses by general practice. In terms of a breakdown in age, and importantly, over 80% of people aged 70 years and over have received a first dose, and 40.3% have been fully vaccinated. As the Premier said, it is very important that you have 2 doses of the vaccine to get the best protection against COVID-19. We have started to see a small percentage of people, both in our community clinics and GPs, not show up for their second dose appointment. If you have a second dose appointment coming up over the next few weeks or months, then please prioritise this so that you get the maximum effectiveness and you don't suffer the severe effects of COVID-19. This week we'll see the first day of operation of our new Hobart CBD clinic on the corner of Liverpool and Elizabeth Street. We have lots of appointments available this week in our additional support clinics in both Hobart and Launceston. If you are working in the disability sector or are living with disability or are caring for someone, then please make an appointment today. You'll be able to get a vaccine in the next few days. Again, please don't wait. There is no reason to wait. There are appointments that are there for you. Bookings for our 2 new Pfizer clinics in Ulverston and Devonport are performing strongly, but there are lots of available appointments. If you are on the northwest coast and are aged 40 to 59 or age 16 plus and living with an underlying medical condition or an aged care or disability worker or other critical healthcare worker, then get yourself an appointment by calling the Public Health Hotline or book online at coronavirus.tas.gov.au. Our clinics are in place in a location for a limited time, so please take the opportunity, if you are on the northwest coast, to book your appointment now and don't wait, vaccinate. We're delivering second doses in our community clinics over the next few weeks in the following locations: Brighton, Deloraine, Huonville, Kingston, Rosny, Launceston, New Norfolk and Wynyard. Our Pfizer clinics that have available appointments are Devonport, Ulverston, Launceston General Hospital, our additional support clinics in Launceston and Hobart, Moona, Hobart CBD Clinic and the Royal Hobart Hospital Clinic. Again, I remind Tasmanians to take the opportunity to get vaccinated and protect yourselves, your loved ones and the people that you work with. And I'll open for questions.
So I saw a Facebook post from someone who had been booked in for their second dose. They're over the age of 60. They were booked in for their second dose on the 30th of June. Then the same day they received a text saying that that appointment had been changed to the 20th of July. And on the 14th they received another text saying that it had actually been on the 30th of June and that they missed their appointment. So they've gone back and forth with the hotline and the app, and there's just a lot of confusing information about when she's actually meant to turn up for her second jab. What's going on? How do people book in for that second jab and make it a clear and concise way to do it?
Well, first up, I'm very happy to take the details of that person if you have them, so that we can get in contact with them. I'm not aware of that particular individual case, and I haven't heard of previous reports about cancellations. I mean, in very rare occurrences or where there's been a significant change to the vaccine rollout, we have had to move people from a particular clinic, for example, where we had the changes in age thresholds, but that's been rare. For example, I was down with my 92-year-old dad at the Kingston Clinic this morning to make sure that he got his second vaccination, and it was absolutely humming down there. So yeah, we just need to look into that and make sure that they've got their second dose appointment.
All good?
Now we've got time, we're just... Do you think it's likely that those children and students will be able to return to school next week at this stage?
Look, in terms of the situation with mask wearing, we'll provide an update on Friday. Obviously, through the course of this week, we'll work with the Department of Education. And I would note this, the public health advice is very clear that they are a very low risk, but obviously school environments are more difficult to manage, and therefore the government has taken the decision that students should stay away for this week, whilst and staff stay away this week whilst this unusual circumstance exists. But we'll get further public health advice in terms of Victoria, as we've heard, later this week, and obviously in terms of South Australians, they're currently on the rolling 14-day period. But we'll update schools on Friday, and hopefully we'll be able to return to some form of normality next week.
Do we know how many staff members have been caught up in those restrictions?
Look, at this stage, my understanding is in total, this is both teachers and support staff, it's between 240 and 250 people. And we don't have, being the first full day of attendance for public schools today, We obviously don't have those numbers, but it's estimated that it would be potentially close to 1,000 students that might be affected.
And so just to be clear, with the students who aren't to be at school at the moment, it's students who've returned from Victoria.
And South Australia.
And South Australia, but Victoria is until at least 11:59 p.m. or whenever that update is on Friday, but the South Australian students is for 14 days from when they...
As it stands, until there's further public health advice. Now, if I could just make the point, and I'm sure Dr. Veitch will jump in and correct me if I'm wrong, but the risk in Victoria, in effect, we would hope to see diminish over time. As it was last Thursday night that we put the restrictions on in terms of the border, and therefore, as exposure sites are being listed by the Victorians, one would think that it'll be exposure sites that are arising more currently, if you like, those this week. There have been a couple that have been put on from prior to the last Thursday, which is why we're keeping the protocol in place at the moment. But in Victoria, we would expect that risk level to continue to come down, and as it comes down, then we'll make a decision as to whether or not mask wearing needs to continue. In terms of South Australia, it's obviously very, very new, the circumstance there, and that risk may increase. But we'll continue to monitor it on a day-by-day basis. But in terms of the rules, and I did note a question before about whether there are issues in terms of people understanding them. They really are simple. If you've come back from South Australia or Victoria into Tasmania from the 8th of July, you need to wear a mask. In terms of South Australia, it's currently a rolling 14-day period, depending on when you were last in South Australia. For Victoria, we'll review the situation on Friday.
And what kind of supports, I guess, for some of those Tasmanian students who've returned from South Australia, they may actually be missing upwards of a week of school. What kind of supports are in place from the Education Department?
Well, look, that's a hypothetical, depending on what how the situation works its way through in South Australia. But in terms, I'd make this point. Our schools, as a result of what we went through last year, and our teachers and our parents and our students are well versed at learning from home. And so the learning from home resources will be made available, and obviously we'll work with those students that are affected to ensure that their learning can continue.
Done on COVID? Yeah. What's your reaction to news that report to the Hobart City Council on the cableway project has recommended that it be refused?
Well, look, that's a matter for the Hobart City Council. Our position has always been that the cable car needed to go through the appropriate planning processes. That's exactly what's occurring now, so I'm not going to speculate on what the Hobart City Council may or may not do in terms of a planning decision that will be before them next week.
Do you think that the cableway project fits the bill for major projects declaration under that legislation?
Look, we've said before that the major projects legislation would not be utilised, that it needs to go through the normal planning process. I would make this point. I personally, and as a party, we do support the cable car project. We think that it would certainly be something that would add value to the City of Hobart in terms of an offering moving forward. But again, it needs to go through the planning process. If
the City Council takes the advice or the recommendation of the report, though, is it a consideration for the government to declare it a major project, or to...
Well, look, could I make this point? I'm not going to deal with hypotheticals today, and I understand what you're trying to do. Where our position's been clear that it needs to go through the planning process. That's underway at the moment, and Hobart City Council will make its decision next week.
Okay, that's all.
Thank you.
Thank you.